this one is going to be a fairly simple lecture. Trigger point injections. So let's show you. So basically, trigger points are found in many areas, and there are two types of trigger points. There's an active trigger point and there is a latent trigger point. The active trigger point is the trigger point that is actually causing pain and discomfort. The latent trigger point is where you're going to actually feel, and you're going to feel that taut band that we've been telling you about, but is asymptomatic. It's not causing any type of discomfort. So the trigger points by definition is a taut muscle band that has a specific radiating pattern. A specific radiating pattern. If you notice, I use the word radiating instead of referred, because when I'm talking about radicular pain, that's when I will use a referral pattern. When I'm talking about this type of things, is a radiating pattern. Trigger points can be injected very, very safely, and you could inject almost anything to include anything. Evidence-based medicine has shown pretty much that anything you inject, whether lidocaine alone, whether the combination of lidocaine and Kenalog, whether you inject Botox, whether you use prolotherapy, whether you use Serapin, whether it's dry needling, everything is basically the same as far as therapeutic results. However, if you're going to be dry needling, guess what? The insurance company is not going to be paying for dry needling. So therefore, in order for the insurance company to pay, you could use any of those agents that I told you. Before, I was using the combination of a steroid, such as Kenalog, and an anesthetic, such as lidocaine, to inject them. But after reading the literature and reading the evidence-based medicine, basically, the only thing I use now is lidocaine. And so basically, in order to perform your trigger point injection, you come at you feel first for this nodule. You may want to hold the nodule with 2 fingers because it tends to slip. Go directly into a 90-degree angle and inject. Then retract your needle without coming out and reposition your needle to come north. Inject. How much are you going to inject? Well, the total amount is probably about 1 cc. So and it's anywhere, there's a range, like from 0.5 to 1 cc. So I may want to inject 0.3 here, retract my needle, reposition my needle, come north, inject 0.3, retract, reposition my needle, and give another 0.3, and that way I have given almost 1 ml of solutions, and that is probably all you're going to need. Okay? So fairly simple. Now, how can I perform this? Basically, I can perform this, and you can do it also blindfolded. But guess what? You could perform this procedure under ultrasound guidance, and if you perform this procedure under ultrasound guidance, the ultrasound guidance will reimburse you better than performing the procedure by itself without the guidance. So the guidance will pay you more than the procedure. Incredible, right, guys?
Does Medicare
Yes, Medicare reimburses that. So, this is the thing. Mark Twain said a little knowledge is a dangerous thing. So you see, just by this little information that I provided to you, you will be able to increase your revenues immediately greater than 100% when you're performing trigger point injections. Now, who needs trigger point injections? Almost everyone that comes to you with neck pain, with back pain, because neck and back pain tend to be multifactorial. And because they tend to be multifactorial, many times a trigger point may be causing some of that discomfort that they're experiencing. So the key here is what? Seek and ye shall find. If you don't seek them, you don't look for them, you're not going to find them. Now, very simple. I could come to him and I could start locating here, and I know exactly which trigger points are the ones that may, and right here, look how he's right here in this upper trapezius, he has a trigger point. Okay? He probably didn't even know about it. See? Look at that. You know, a jerk reaction, twist reaction that he's having, pulling away when I'm performing this trigger point, which is one of the cardinal signs. If I seek this in every single one of you, I could assure you that I will find that, to include Abby, who is 17 years old. No, she's not. So, but I could go ahead and do that. So seek and ye shall find.